This is something that I really struggled with as a third, fourth, and final year, and even now as an intern. When you've listened to 5 hearts over your lifetime, there's no way you'll be able to identify that pansystolic murmur that the cardiologist who's listened to thousands and thousands of hearts has pointed out to you. The only advice that I have here is practice. We all start off at the beginning as a first year clinical student, and you can bet your bottom dollar when that cardiologist had just started off as a third year or as a clinical student, then they wouldn't have been able to identify that pansystolic
It's really hard
murmur.
to auscultate for crackles and murmurs. I found that I wasn't that confident in the first few months, and I always felt more comfortable just taking a history from a patient. But in hindsight, I should have just launched in and asked to do an examination, because once you've built up that rapport through the history, I think most patients are pretty willing to do that. So my first tip would just be to auscultate everyone, even if they don't have a heart problem. Secondly, I'd suggest having a booklet or something with the summary of all the clinical exams that you've learned, because it really comes in handy when you're running after a consultant, when you can have a look at a booklet and just refresh yourself on the renal exam that's coming up.
So it was really hard to try to auscultate for those murmurs, but you eventually get the hang of it. My best tip would probably be to try to figure out why you're doing particular things in the examination, and then everything else starts making sense as you understand.
My main tip for clinical exams is to see and examine as many patients as possible, even when you can't be bothered. Try and challenge yourself to examine and take a history from at least 3 patients a day. Even if they're normal and they have no clinical signs, it's not until you're really comfortable with what normal is that you can even hope to work out what abnormal is. So just examine as many normal patients as you can, and the OSCEs will be easy.
Doing a clinical exam, it's very different than when you learn it in your clinical skills tubes. Obviously, because these are real patients, they're in real pain, and they don't know any of the medical jargon which you're going to throw at them. So explaining things is very different, and you're actually looking for actual signs instead of just running through the motions, which is very different. I think the key to building confidence with them is a little bit fake it till you make it. So start off with patients you've been told by the nurses or other students that these are the patients who have really good signs, they're going to give you a really good examination, they're really happy to see you as well, because some will have been seen by 4 or 5 students just before that. They might not be too happy if you do an exam on them. But yeah, start off with the easy patients, build up your confidence, hear what certain signs sound like or look like, and then you can start moving on to harder patients which you don't know what's wrong with them, and start working it out for yourself. I think that's a pretty good way to build up your confidence and your skill with clinical exams.
Today is gonna be the day that they're gonna throw it back to you. By now you should have somehow realized what you gotta do.
First thing is, don't be afraid to ask. There's nothing to lose by asking, but then you lose a lot by not asking. So ask the nurses, ask doctors, ask patients, and don't worry about like being embarrassed or anything like that, because they're usually there to help you. Tip number 2 is read up on the condition that you see that day. So for example, if you see multiple sclerosis, just read up on it, and then when you associate your reading with a patient that you've seen, it's much easier to remember what you've seen. Okay? And the last thing is start your logbooks earlier, because you don't want unnecessary stress when it's time for exams and stuff like that.
My top 3 tips for 3rd year. I think first one, in the hospital and in life, the key to happiness is lowering expectations. So lower expectations for a hospital coffee. It's free, but it'll take a cost on your taste buds, definitely. So try and get used to that as early as you can. My second tip is definitely try and stay on top of things. 3rd year has a lot of freedom behind it, which is great, but it means you could definitely get away with doing very little throughout the year, and then you don't want to leave too much to cram at the end of the year, because that's not how it's going to stick in. So try and work in regular intervals and keep your work up at a reasonable level throughout the year. And my third final tip is probably try and use a mixture of resources. You have this great resource in being at a hospital where you can talk to real patients, talk to the doctors, and that's like invaluable. You can't get that anywhere else. So make sure you're using that every single day. But on the other hand, don't just go into the hospital, see patients and come home and then think that's it for the day. So if you see a patient with a certain disease, maybe go home and do a bit of reading up on it, because you want it to stick in the long run to exams and when you're real doctors in the future. So I think that's the best way.
My top 3 tips for third year would probably be that one, try to figure out your own learning style. If you're a really practical learner, like I was, maybe try to spend a lot of time on the ward, try to get the doctors to involve you and to let you do things. But if you're more a book learner, maybe you can get yourself excused whenever there's quiet time on the ward and try to go to the library and learn there. 2, try to learn from 4th and 5th years. I found that I got most of my third year knowledge from them. They've been through the Monash system, they know exactly what you need to know, and because they've been through it, they can teach it really, really well. So try to learn from them. Definitely attend study groups with 4th and 5th years. And if there's a 5th year on your ward or with you on ward rounds, try to learn from them there, because there can be a lot of wasted time on ward rounds. And lastly, try to support each other. Third year can be quite difficult, especially because of the transition. So try to support each other as much as possible.
My top 3 tips for third year would be, number 1, don't drop your co-curriculars. You can feel in the way, you can feel like you don't know anything, you can feel like you're a danger to the patients. And yes, you're a medical student and you're a future doctor, but you're also a friend, a daughter, a leader, a basketballer, a musician, an actor, whatever. And those things are so important, you should never discount them. Number 2, try and see one of every procedure or surgery that's on offer. You never know when you'll get the opportunity again, and you'll be able to empathise with your patients so much better if you've seen what they're going to go through. Number 3, have a good system of organising your notes so you can just keep adding to things as the year goes on. Don't fill 10 exercise books with meaningless scribble like I did.
3 tips. Alright, so I know it sounds cliche, but try and study consistently. Unlike previous years where you might have 4 exams per year, third year everything happens at the end of the year and it's easy to fall behind, and that certainly happened to me. Another tip or thing that I try and remember sometimes when I'm having a bad day is, however terrible your day has been, whether you were late to consultant ward round because of the terrible traffic on the Monash freeway, or you did poorly in assessment, remember that the patient lying in the bed in front of you is much more likely to be having a more terrible day. So keep that in mind in your interactions with patients and other people. And third tip is, remember that there's more to life than medicine. Keep enjoying your hobbies, catching up with friends and families, and doing the things that you enjoy, because it's really important.
It might seem crazy what I'm about to say. Sunshine, she's here, you can take a break.
The highlight of third year for me, it's a hard one. It was a great year. Got really close to everyone in at my site. But I think my highlight still has to be the time I got a PS3 for the common room. A lot of FIFA was played. Probably not as much study was done, but it was still definitely a highlight for third year.
I really enjoyed third year. It was a great year. I had some really wonderful moments with patients that I'll remember forever. I learnt so much from them and had so many great laughs and shared great stories. Being in third year is like a golden ticket to the hospital. There's really no limit to what you can see or do, and that's really exciting. I really enjoyed having so many new experiences and seeing exactly how it all operates inside a hospital.
So it is a year where you have exponential learning, and you do learn a lot without realising it, and it's really fun. So just have fun, embrace, good luck and all the best.
My favourite thing about third year was probably the fact that we were in groups. So MNC put us in groups of 5 together, and we did all our rotations together. I absolutely loved my group to death. They were so supportive, and they made the experience so much easier and so much more enjoyable. So we did everything together from day one. We found our first rotations together, our first ward, our first couple of clinics, and we supported each other throughout the whole thing. Even at the end, we knew what was missing from everyone's logbooks, and we tried to go out of our way to make sure that everyone's logbooks were done. And it was really, really enjoyable, but also it made the experience a lot less scary, because it was like, it made us feel okay to be vulnerable, to say that I don't know, or I'm really lost, etc. And it was also less scary to make mistakes as a group, rather than if you were just by yourself. So I really loved that about third year, and I'm really grateful to my group. They were amazing.
Which parts of third year did I enjoy the most? Well, probably getting out of lecture theatres from the preclinical years. Getting out to meet and talk to real patients for the first time was really enjoyable and really special. Getting out of the hospital on time and doing fun things like hanging with friends or playing sport or music was also a lot of fun. And also getting to the end of the year and feeling like I'd learned something. That was really cool as well.
I really enjoyed the social side of third year. At the rural sites where I was, we had 21sts most weekends, but we would do pub trivia every week. We had barbecues, we went out, we went travelling in the breaks, we played games, we just had a really good year. So make the most of it, learn the medicine, and make good notes that you can use again in fourth year, but really take time out and just have a lot of fun. It's a great year. It sounds scary, you'll be fine. If you have any questions, please feel free to come and ask me, and I'll see you in the hospitals. Bye.